So I'm going to hand over now to Phil, and I'll go off camera.
Good afternoon, everyone, and welcome to this social work session entitled Themes and Lessons Learned from National Reviews and the Role of Regulation. My name's Phil Hallam, and I'm the Executive Director of Regulation here at Social Work England. So greetings from a chilly but sunny Sheffield. Our panel today are Michelle O'Rourke, a Domestic Homicide Oversight Mechanism Lead at the Domestic Abuse Commissioner's Office, Isabelle Trowler, Chief Social Worker for Children and Families and member of the Child Safeguarding Practice Review Panel, and Anthony Douglas, CBE, Independent Chair of the Suffolk Safeguarding Partnership and DFE Commissioner. And so welcome to our panel as well. We've got quite a packed session today, so just very briefly, our session today discusses and explores outcomes, themes and lessons learned from national reviews. This will include domestic homicide reviews, child safeguarding practice reviews and safeguarding adult reviews, and we'll also consider the role of regulation alongside those reviews. So our panellists will discuss the themes and lessons learned from their area of review, and then we'll consider together the question, what is your view of the role of regulation and how does it relate to the findings from the reviews we've discussed today? We'll then take some questions from the audience that have been sent to us in advance, and hopefully, if time allows, some further questions from the virtual floor. So that's really just what I wanted to say by way of introduction. So to begin, I'd like to welcome again Michelle. And Michelle, over to you.
Thank you very much, and thank you for inviting me to speak today. My name is Michelle O'Rourke. I'm the Domestic Homicide Oversight Mechanism Lead within the Domestic Abuse Commissioner's Office. I joined the team in October 2021 as a practice and partnerships geographic lead for the North, and came into this role in June last year. So we've been working on the development of an oversight mechanism for DHRs, which will sit quite separately to the process itself in terms of how a DHR is run and delivered, but we'll talk a little bit about that. And I came to this from the voluntary sector, so spent about 18 years as a IDVA and service manager, and then a chief exec of a specialist domestic abuse charity. So kind of coming at it with that lens as well. Just moving on to the next slide, Heather. Sorry, I'm not controlling these slides, so we'll keep having to ask someone to move them on. In terms of domestic homicide reviews, I don't want to kind of read this out to you. We think you can all kind of find the statutory guidance and the legislation is out there, but just to kind of give an overview of what a DHR is. They were introduced by Section 9 of the Domestic Violence, Crime and Victims Act, so back in 2004, but didn't actually kind of come into delivery until, I think the first one was held in 2011. So we do have a number of years of DHRs in practice, and they are about a review of the circumstances in which the death of a person aged 16 or over has or appears to have resulted from violence, abuse or neglect, either by a person with whom they were related or who was or had been in an intimate personal relationship. It can also be a member of the same household, and they're held with a view to identifying the lessons to be learned from the death. And there is statutory guidance which outlines the purpose of a review and how that should be conducted. And that has been refreshed a number of times and is currently undergoing a further refresh. The last draft of the statutory guidance was in 2016, and that kind of related to the introduction of suicide, domestic abuse related suicide deaths, and the inclusion of those. So that's just kind of a brief overview of where the DHR, what a DHR actually is. We could just move on to the next slide, please, Heather. So this just kind of gives you an overview of the purpose of a DHR. So this is taken from the statutory guidance. It really is about establishing what lessons are to be learned from a domestic homicide and the way in which local professionals and organisations work either individually or together to safeguard victims. About identifying clearly what those lessons are within and between agencies and how and to what timescale they would be acted on. Applying those to service responses and including kind of changes to inform national and local policy and procedure, and prevent domestic violence and homicide and improve service responses. So it's also about contributing to a better understanding of the nature of domestic abuse and highlighting any good practice within that. I think I've included a smaller another paragraph as it kind of goes through, because it wasn't going to put the whole of the kind of purpose behind that, but you can definitely go to the statutory guidance and see it. But just in terms of this particular paragraph where it references illuminating the past to make the future safer, and I think that's very much what the DHRs try to do, to include families and friends and those close to victims within that process in order for them to kind of elevate their voices and bring their story through a DHR. Just moving on to the next slide, please. I'm not going to talk in detail about themes and trends from recommendations or from kind of DHRs themselves, partly because the work that we're doing on the oversight mechanism is in the really early stages, and we haven't begun to kind of analyse from our perspective those recommendations. But that's not to say that work hasn't been undertaken in this area, and there is a body of research that has started to develop around DHRs. One being kind of Home Office funded research, which is this key findings and analysis from domestic homicide reviews. And you'll see just from the kind of bullet points there, the kind of themes that are coming out of those reports and that analysis within those trends. Firstly being contact and the need for greater contact with victims, and recognition that perpetrators can control the victim's contact with agencies. It talks about assessment and the need to improve risk assessments, carers assessments, or mental health assessments. And I think that's one of the kind of things that we're starting, as we're doing the engagement with the oversight mechanism, starting to understand a lot more in the context of intimate partner violence, adult family homicide, and how kind of some of those assessment needs may differ depending on the circumstances surrounding a particular death. Records in terms of information being missing or not shared between agencies. Support, and that specifically refers to support for staff whose work involved cases of domestic abuse, in cases where support for victims wasn't necessarily identified, or where the need for support was identified but there wasn't then a plan to provide that support. Information and possibly linking back to records, but the need to improve information sharing between agencies and to hold accurate information and then use it effectively to manage risk. The analysis talks about risk itself, and the right risk level needs to be identified, and the information held by other agencies included within that. Talks about referrals not always being made when needed, and training and the need to update training and make it accessible. And finally, kind of looking at policy and occasions when action was not taken in line with policy, or there were agencies without a domestic abuse policy. Just moving on to the next slide, please, Heather. And then again, from the same piece of research, there were some key findings around the recommendations in domestic homicide reviews, and who they were for. So 25% for partnerships, and that would primarily relate to kind of community safety partnerships, 24% for health organisations across kind of health provision, and 13% for the police. We know that 28% of the recommendations were to review existing practice, and 26% were to raise awareness, of which a significant proportion of that were about raising awareness about domestic abuse to staff. And 16% of the recommendations concerned information, including the quality of information sharing between agencies. So I would definitely recommend anybody kind of interested in understanding a little bit more about that to kind of take a look at that research. But at the moment, and that's kind of the Home Office compiled analysis of DHRs. We could just move on to the next slide. I just wanted to kind of highlight some of the research that's out there along similar lines. So the HALT project, which is Manchester University, they've developed a repository of DHRs which you can access through their website, and briefing papers, one which kind of looks at a systematic review of DHRs and the processes and recommendations, and found within that there's a focus on DVA training and awareness around domestic homicide, provision and coordination of services, and children impacted by domestic violence, abuse and domestic homicide. And then just to highlight the VKPP project, which is has a domestic homicide project, which has just released their second annual report. It's Home Office funded. It's a partnership approach between NPCC, VKPP and the College of Policing. And that report focuses on how policing can improve its responses to domestic abuse and domestic homicide, and that does include victim suicide after domestic abuse as well. Just moving on to the next slide, please, Heather. I just wanted to talk briefly about the domestic homicide oversight mechanism. So the DHR process itself is led by CSPs. However, until now, we haven't had an overarching kind of repository of DHRs or any oversight at national or local level. That goes beyond the kind of partnership that delivers the DHRs themselves. So the government made a commitment in the Tackling Domestic Abuse Plan to reform a number of aspects of DHRs. That includes bolstering the role of the Quality Assurance Panel, introducing a formal role for the Domestic Abuse Commissioner, and exploring the introduction of a formal role for police and crime commissioners. They are not listed or kind of referenced within the statutory guidance currently because the police and crime commissioner roles came in post DHR. So that's one of the reasons why they're really looking to explore that role and kind of address that within the refresh of the statutory guidance. Just to say, with the statutory guidance, the Home Office have kind of said that that will be a public consultation, so there will be an opportunity to feed into any kind of views on those things. And within the formal role for the DAC, there will be responsibility for identifying key themes and learning, advising government on where to make improvements at a national level, and identifying and supporting local and regional improvements as well. Just moving on, please, Heather. So this is just to give you an overview of the strategic objectives of the oversight mechanism. The aim is ultimately to prevent future homicide. We want to do that by improving accountability and implementation. So that's really kind of thinking about the next steps with regards to domestic homicide reviews following their publication, and the changes in policy and practice that are required to prevent future deaths. So it's really about kind of better local agency accountability and national accountability as well. And there's currently little oversight and a high degree of local variation. So that's something we are hoping to address through this mechanism. And then raising the profile of domestic abuse and domestic homicide, so stakeholders in national and local policy and practice areas see prevention of domestic abuse related deaths as a priority. So we want to track and understand the trends around implementation at local level. And although we won't be looking for local recommendations that have national significance, we definitely recognise that there may be occasions where we are seeing recurring recommendations or recommendations that are coming up in similar areas that perhaps are could be happening elsewhere, or when we're exploring that, we find that that is an issue in local areas, regardless of whether they've had a DHR or not. And again, that might be something we would want to then raise at national level to say, you know, we think that this is not a local issue, this is a national issue that that should be addressed within kind of national policy, and have an opportunity to state that and recommend that. Or Nicole, through her powers as Domestic Abuse Commissioner, would do that. And then supporting enabling process improvements for DHRs and other relevant reviews to ensure they're effective, value-adding, consistent and survivor and family centred as well. So just kind of keeping families at the centre of the process post-publication, as well as kind of how they're included within the DHRs. And I think when we talk about supporting and enabling process improvement, that's very much about our office working with local areas and with partners to understand kind of where some of the barriers may be, what some of the challenges are with implementing recommendations, what role the Domestic Abuse Commissioner could play in kind of the escalation or unblocking of any issues that are proving difficult to implement at local level. And I think the key to that is the independence of the Domestic Abuse Commissioner role itself, and how we can kind of bring that independent viewpoint to any kind of sticking points at local areas or nationally. And just moving on to the next slide, please. This, I won't focus too much on this. This was just, and I think our slides are probably on mine will be shared after this, but it was just to kind of give you a bit of an idea of the key roles of each organisation or body in terms of how they play within a DHR and kind of what will change and what won't. And it's just really, I think the key thing to say on this is that the role of the CSP won't change as a result of the oversight that we'll be putting in place. They will still hold responsibility for DHRs, they'll still commission them, they'll still be responsible for the implementation of the action plan and the recommendations themselves. So what we'll be doing is working with them on kind of what we understand about the recommendations themselves and the change that we see as a result of them. Home Office, again, will hold overall responsibility for DHRs, and that kind of overall responsibility sits with the Home Secretary. And then I think just everyone in this kind of space will play some role in dissemination of kind of learning and best practice. Just to move on, please, Heather. That again just was to give you a bit of an overview of where the focus might differ in terms of local and national oversight. So at local level, we're likely to be more interested in the actions themselves, the specific actions that come from the recommendations and how they're being implemented, and where they're kind of not being implemented, understanding really a bit more about why that might be. We know, and I think many of you on this call are probably involved in some way in reviews and within DHRs, and we know that they're taking a lot longer than the statutory guidance would say that they should, and that in itself can kind of impact on the implementation of change and recommendations, although we know that areas will or should be getting on with kind of putting those actions in place regardless. But again, I think it's really important that we understand what some of the kind of challenges might be in implementing those. And then from a national perspective, really interested in looking at what the recurring themes are, what are those national recommendations and who are they for? And also just kind of thinking about systems change and improvement in DHR processes. So the oversight mechanism and the role of the DAC is not specifically about DHR process improvement, but what we do recognise is that as we're kind of doing this work, there will be things that we glean and learn from local areas about what a good recommendation might look like and what good practice looks like, and we definitely think there'll be an opportunity to feed that into the kind of future development of DHR processes and share that nationally as well. Just moving on to the next slide, and please do tell me if I need to be a bit quicker. This was just to give you the elements of the work itself, but what do we mean by the mechanism? And there are three kind of strands to it, really. A database that we'll be procuring, and we're just in the process of procuring at the moment, and that will do the tracking and analysis of kind of themes and recommendations, because the Home Office are now developing a national repository, and that will be accessible. Then we'll be utilising that information in terms of how we kind of develop our database, but it isn't preventing us from kind of getting on with doing some of that work. And then engagement, so just to say that there is the kind of analysis that we'll be doing, but there's also the reactive engagement as well. So whilst we're developing an overall mechanism, the day-to-day work is happening around kind of those local conversations that are happening, conversations with government departments, conversations with health bodies, policing, in local areas and more broadly, to when we know that there are particular issues coming up and we're kind of becoming aware of them. CSPs are asked to share, and it's within the legislation around that they would share their DHRs with the Domestic Abuse Commissioner. So we should be kind of receiving those as they're published. And then reporting, just really to say that there will be an annual report when we have our first full year of data, which we hope to be in 2024, an annual report that will be shared with ministers, and within that, the Domestic Abuse Commissioner will be able to make recommendations using her legislative powers, and that would then mean that she would expect a kind of a response to that within 56 days. And then in terms of reporting as well, just kind of sharing anything that we learn and develop as we go. We will be doing an interim report just in terms of like where we've got to and some of the kind of challenges and barriers around that, and hopefully be able to share that in the near future. And then just quickly moving on, please, Heather. You can skip this one. I think it's covered in other slides. Just really an overview of the process we're going through. It's a two-phased process. I think the thing to say on here is that phase 2 will be where we'll be looking at how we incorporate other reviews into the work that we're doing on oversight, so that it is joined up with kind of things that are being learned through prevention of future death reports, safeguarding adult reviews, the SUSR process that the Welsh Government are developing, mental health homicide reviews and child safeguarding practice reviews. And we'll be defining kind of what the process looks like at local level and rolling that out. And then I think maybe one more slide and I'll kind of skip the others, Heather, that's fine. This is just to let you know that we have commissioned some research into the themes and trends within DHR recommendations, and that's looking at particular areas, so health, criminal justice, children's services and adult social care. And we've commissioned HALT to do that research, so they're drawing on their repository of DHRs and looking at the last 3 to 5 years. Within that, we've asked them to produce a briefing paper that we can kind of share at local level and do some engagement work with, but also a full report and an exec summary, and within that focusing on kind of key areas, so equality and diversity, including intersectionality, thinking about suicide, and also thinking about kind of female perpetrators, and within the kind of adult social care and health reports specifically, there's a focus on kind of understanding adult family homicide and the differences between intimate partner violence and some of the things that are kind of reoccurring within adult family homicide. And then we just move on to the next slide. You can move on again. I think that's just the summary. Yeah. I mean, all the information's there in the slide in terms of the work that we do, but more than happy for anyone to reach out to me in the future if there's anything people wanted to discuss further. Thank you very much.
Thank you very much, Michelle. That was really, really helpful. Thank you. We'll move straight on then. So if I can introduce again Isabelle Trowler. Isabelle, over to you.
Excellent. Well, I'm going to do something slightly different, and because I've got about 10 minutes, I think, and I wanted to just show the audience how the numerous reviews that have taken place looking into children's social care and multi-agency practice in child protection over many years, and how it threads through to national policy shifts. And I'm a member of the National Safeguarding Practice Review Panel. I've been there since its inception about 3 or even 4 years ago now. And we have seen thousands of children that and where they have either died or been seriously injured in the context of abuse and neglect. So I wanted to touch on some of the key messages, although you will be very familiar with those messages because very sadly they don't change. And that's one of the sort of endless challenges that the leadership of this national system faces. I wanted to touch briefly on some of the key findings from the review into the deaths of Arthur Lavinia Hughes and Star Hobson, because they have had a profound impact on the way that government is thinking about children's social care and multi-agency safeguarding partnership arrangements. And of course, that's linked to the far-reaching review led by Josh McAllister on the review of children's social care. And then to finally just touch on some of the ideas about how we should change practice, particularly child protection practice, for this conversation in response to the lessons that we learn, but we keep learning the same lessons. So just to give you a sense that on average, we see about 400 to 500 serious notifications each year. Last year, it was more like 400. And really interestingly is that over 60%, in fact, it was 68% of those children are either known to children's social care, they are, you know, an open case, or the family is, or they've been previously known. And I'm never quite sure whether that's a good or a bad thing, because on the one hand, it says we knew that these children had really significant need and that they needed the help of the state. And then on the other hand, you're thinking, well, we knew these children, but we didn't stop this, this serious injury or this death. And that's a sort of, an ongoing debate about what this really reflects. Now, the numbers of children, people always say in defence of the system, well, they're very small. But actually, the practice that goes before the serious incident is often just business as usual. So we think that it does reflect more broadly how often we don't do as good a job as we should in child protection. And you can correlate that with other sources of evidence. And just to focus on, and I don't have slides because I just wanted to talk directly to you. But if you haven't read the review of Arthur and Starr, then really, I really suggest that you do, because it's a very, very powerful report. And I was part of the review team, and it was a very difficult piece of work. The families are completely destroyed by what happened to those children. And many of the things that we felt went wrong, we see time and time again. So this, perennial difficulty that we have in information sharing, that we have arrangements that cause real friction between people, so that it's really hard to share the right information at the right point. And interestingly, though, even when we do have the right information and the right people have the right information, we don't always act on it. Very clear commentary on the importance of critical thinking and the opportunity to challenge the kind of working hypotheses, both within and between agencies. We could see that there was a sort of repeat failure to trigger key actions that might have protected both Arthur and Starr, even when they were in a formal child protection Section 47 process. So we really had to conclude that we had to have a much sharper, more forensic approach to child protection practice, that leaders had to have a much more powerful and enabling impact on child protection practice, that practice was not something that can be detached from the strategic ownership of the system, and that we thought that really critically in Arthur and Starr's case, that the family voice, the extended family voice, was completely drowned out, and that we'd stopped listening to some of the key players in those children's lives. Now, that Arthur and Starr were two of the children that we heard about last year. But as I said, the messages that we keep, if you look at any of the triennial serious case reviews going back across the whole of my career, 30 years, and Anthony, of course, will go even further than that if he doesn't mind me saying. But we know these difficulties, and we have to keep trying to resolve them. Although I think it's really important to acknowledge and recognise that there will always be these tragedies, but we have to make our best efforts to try and change things for children. And when you look more broadly at some of the recent serious case reviews and the kind of overarching reports, then things like the importance of critical thinking and professional challenge become so important. Really basic things about the quality, frequency of supervision, what stands in the way of escalating concerns both within families and across professions. That we thought that in particular that there was this need for keeping the perspective of whole family in mind, and that there were we've seen many examples of as I've said, where really key family members were not heard, that sometimes children are not heard, and that we need to have a really broad perspective on who's in the family and the nature of those relationships. And of course, that links very much to Michelle's contribution and domestic abuse in families, that domestic abuse is featuring in over 40% of families that are notified to the panel. So it's such a red flag in terms of things going seriously wrong for children. Now, just to move on a bit, I wanted to talk about, and you might have some questions about this afterwards, but talk about the strategy that the government has recently published on the development of children's social care. This is out for consultation. So again, if you haven't seen it, you haven't read it, then really this is your opportunity to engage in some of the proposals that government is making. There's also a national children's social care framework, which is also out for consultation, and that's trying to articulate the ways in which we want to see all local authorities and broader safeguarding partnerships working with families. But there's this really critical part of the strategy, which is over the next 2 years to develop a number of pathfinders. And within those pathfinders, we want to see quite a different approach to child protection, and that we are wanting to see a real, whole-scale shift towards what is termed family help, that leads to families getting the help that they need, giving much more precision about what we mean by child protection, what we mean by likely or actual significant harm, which is actually a very small number of those families. So we want to see, much more proactive help to a larger group of families. But when you do come across that statutory threshold, that significant harm threshold, that we really, make sure that we do everything, that we're much more forensic in our approach to Section 47 inquiries and child protection planning, and that we're inviting partnerships to think about a different skill set for undertaking Section 47s. We're very traditional and stuck in a particular mode of who does what. We are exploring the potential to open up the role of lead professional under Section 17, which has been the sole preserve of social workers, again, for us, for most of my career, to a larger set of people, so that we know that, for example, we've had huge success in authorities where we have introduced adults workers, so domestic abuse specialists, for example, addiction specialists, adult mental health specialists, and how that can really switch the focus of support and protection. So there are some big proposals here which have quite profound consequences for the way that we do things. The most controversial, I think, aspect to it is the idea that you would have the family help service, which is the bulk of families that we're working with, but where that threshold of significant harm or suspected significant harm is hit, that we have an additional team, multi-agency team, who work alongside family help and undertake the Section 47 inquiry and oversee the multi-agency child protection planning. So this is the idea is that it provides an additional lens, unfettered by the complexity of the established relationships that practitioners often have with families, that it would allow for the continuity of the family help relationship and the plan of work for the family, whilst this group of multi-agency professionals will conduct those statutory inquiries. Although obviously, family help and people from many agencies would be part of those inquiries. So, potentially there's a really big shift in how we do things. And so again, just to end, just to really focus you in on the consultations so there's as I said, the consultation on the strategy for reform of children's social care, the National Children's Social Care Framework. There are also actually some which will be of interest to some of you, the consultation on changing rules for the use of agency social workers, and potentially introducing national rules about who can be an agency social worker and in what context. And then we're also going to be launching a consultation of working together within the next few weeks, and that this is the document which will contain the real detail of some of the proposals that I've touched on this afternoon. We're going to talk about the role of regulation, I think, after Anthony, but I think that that's a really important part of the picture that we're trying to create here. Thanks.
Thank you, Isabelle. That's really helpful. And moving straight on then to, if I can welcome again, Anthony Douglas. Anthony.
Yes, thanks, Phil. Thanks, Isabelle and Michelle. I'll crack on because with a lunchtime webinar, time is always short. So Suffolk's partnership locally, our safeguarding partnership, is an all ages partnership based upon the premise that whether you're an unborn or non-mobile baby, or whether you're in your last few days of life, you may unfortunately be subject to abuse, neglect, or exploitation. It might take slightly different forms. For an unborn baby, the consequence of transmission of toxic substances across the placenta, the impact of shouting, certainly physical violence inside the womb, right the way through to emotional harm, financial abuse and neglect in the last few days of life. So next slide, please, Heather. I'm going to just cover some local reviews as examples. The first is, these are published reviews on our website at the Suffolk Safeguarding Partnership. Joe Cooley was a 17-year-old boy, very vulnerable, who was exploited and then murdered by 3 other young men. And that was not any deficit of working by social workers, housing workers, mental health workers. It was the sheer difficulty of combating exploitation in the community with an extremely vulnerable person who wants to seek friends and who is either hard to engage or our methods of engagement aren't quite strong enough. May Miller was a 93-year-old woman. She'd been the backbone of her family, and she was killed by a resident in her care home who was admitted without due diligence and without an assessment of his mental health difficulties. He hit her, I think, on his second day in the home with a walking stick and killed her. And the lessons, as Isabelle said, are about information sharing. The admitting home was not aware of who they were admitting. It still happens far too frequently for foster carers and other placements where vulnerable people are being admitted. Maria, 89, died of sepsis. She had a huge amount of support, particularly from health services. Everybody went in to take care of one aspect of her life, but nobody looked at her as a whole person. She was hidden in plain sight. And in the end, she literally rotted away in front of everybody. The 2 sisters, an 11 and 8-year-old girl, chronically sexually abused and neglected over several years. 34 referrals made to the local MASH, again, about specific incidents of neglect. And ironically, when the neglect appeared to be lessening because the older girl was cleaner, didn't smell, the mistake was to downgrade the concern because she was less neglected. In fact, she was being groomed to be sexually exploited and smartened up for that. And then finally, a thematic review of 3 babies who've died, 2 who've died, 1 seriously injured, all through drug and alcohol induced overlay. Unsafe sleeping, not because sleeping with your baby is inherently unsafe, but it certainly is if you're out of your mind on drugs or booze. Next slide, please, Helen. We're evolving, so we really don't want to review case after case and reach the same findings. It's much better to use most available time on implementation. So these are the types of review we use: legally based safeguarding adults reviews and children's practice reviews. Rapid reviews, we've extended those to adults, much the same principles that you often know as much as you need to know in the first 2 to 3 weeks. It's better to look at the system findings once you see them and apply the learning. We're looking increasingly at desktop work. For example, a review of homelessness in Worcestershire is equally applicable in Suffolk, or I would say anywhere else. Not that everybody is the same, everybody's different, of course, but most of the issues facing people who are domestically abused, coercively controlled, homeless, are similar. And we're finding an increasing use of practice learning events and management action, rather than simply reviewing, to put the focus on the action that's needed to systemically improve. Next slide, please, Heather. Here are some of our findings. Too many vulnerable people have been hidden in plain sight. And this wasn't just Maria. Individuals vulnerable to exploitation shouldn't be placed in crime hotspots. And the lack of placements for young adults, young people in extreme need, particularly with special educational needs and disabilities, autism, and other difficulties that compound behavioural challenges and their own emotional challenges, there is nowhere suitable for many of these young people and young adults. And that is often creating a toxic mix of residents. We've had some very serious incidents in A&E recently in Suffolk, again, quite violent, people taking their own life because they shouldn't have been in A&E because of the shortage of appropriate places. And then the last point, learning under pressure is really hard. We found a significant lack of take-up for multi-agency training, getting more difficult for practitioners and managers under pressure. What many of them say is they're bombarded by their own organizations with transactional requirements, procedural requirements, compliance requirements. So they may get better at how their organization wants them to work, but that doesn't mean they're any better as professionals. And that's certainly combining for what people are telling us with the amount of free time that practitioners are giving back to their organizations, going up from roughly 1 day a week to 1.5 days a week. And if you think about that, that's leaving just a few hours a week to actually live your own life. Now, that's a bleak generalization to a general pressure that some people can manage. So finally, the role of regulation for me is balancing the system, making sure the system works, and then that it's working well, not focusing on bad apples. Far fewer bad apples in social care than the police. I've not met anybody yet. As Isabelle said, I've worked quite a long time. It'll be coming up to 50 years since I was first a social worker in Hackney in the 70s, but I've never, I think I might have come across willfully dangerous practitioners 3 times. Thousands of generally hardworking people who, if they need anything, need education and learning. So the fact that that is under so much pressure is a worry. And I think, Heather, that was my last slide.
Thank you very much
Perhaps
indeed, Anthony.
Perhaps it was, perhaps it wasn't. Anyway, I'll end there.
It was indeed your last slide, so thank you. And thank you to all of our speakers today. with the little bit of time that we have left this afternoon, I suppose I would like to sort of ask our speakers to think about the sort of the question. Obviously, we've talked about the reviews, and this session is about the role of regulation and how that intersects potentially with the reviews. And I noticed there, Anthony, you mentioned the phrase bad apples, which is often used in terms of professional regulation about sort of weeding out the bad apples from a profession. But I suppose my interest would be, how does the role of regulation intersect, national regulation intersect with the findings from some of the reviews we've discussed today?
Well, just to kick off, I think there's tremendous underemphasis on powerful emotions felt by children, families, adults, professionals. And we talk about emotional dysregulation for people who are really troubled, but actually the regulation of emotions in the profession, I'd say, is a regulator role. I think it's much better to move out into system findings and systemic improvement than the fitness to practice model, which of course is important. But I would question, it's a bit like complaints, whether that could be re-engineered into something slicker, more immediate, more problem solving and more educative. Unless it's a case of serious gross misconduct where somebody needs to be removed from the profession. I've met a few people in that category, but not many.
Thank you, that's really helpful. Any further thoughts from either of the speakers on the idea of on the regulation point? So Isabelle, sorry.
Yeah, so I mean, I've written here, because I absolutely agree with Anthony, is that, you know, again, I've been around for a long time, and I have very, very, very rarely seen, you know, what you might call reckless practice. You know, social workers in general, it just is not there. And you may have other examples of, you know, so I've certainly seen a lot of racism. I've certainly seen bullying in organisations. So, you know, we're not all saintly. But this idea that there's a lot of reckless practice out there, is not borne out in my experience. I think that fitness to practice and the regulation of individuals is quite fraught in our area, because you know, I think it's complex, and that we know that members of the public, for example, are most likely to refer individuals to the regulator. And you know, anybody that works in our worlds knows how, you know, fractious those relationships can be, and we're doing incredibly intrusive things to people and to families. So it's very fraught territory. So I think of course you have to have a fitness to practice arrangement, that we need to help those individuals move through that process as quickly as possible. I heard that it was this sort of industry standard for it to take 2 years to conclude a fitness to practice investigation. I just think that's, you know, well, I mean, I have to believe it, because that, you know, that is the industry standard, but it's quite incredible that it would take that long. So I think the making sure, though, that practitioners have the right knowledge and skills is really important, because it's a support that should be seen as a supportive function, and getting this kind of context around individuals' right is really, really crucial. But the kind of regulation of the system, I think, has a much bigger role to play, and the kind of vital importance of employers, you know, providing the right context for the practice that they want to see.
Brilliant, thank you. Just moving on then, because I am conscious of time, I've got some questions that are prepared for us in advance by sort of members of the audience. So I think maybe just pick one of those to ask the panel, really. So the question is, how can we share learning across serious case reviews in a system-wide approach around learning, I suppose? And that is obviously, we've touched on this in some of the presentations around the sharing of information, but also, I suppose, around the systemic findings. But you know, what is that? I suppose my question would be, what is the role of the regulator maybe in helping share information, or how do we sort of, you know, collectively make sure information is appropriately shared about the outcomes of these reviews?
I'm just kicking off very quickly. I think you could do some work on how busy practitioners and managers learn under pressure. Is it best inside agencies? Contextualized learning? What is the role of multi-agency training? What is the role of government guidance? What is the out of all these different methods that are used to learn, how is learning best applied? Because that isn't done by inspectorates. It can be done piecemeal by management systems, but I do think it's an important national regulatory function. How learning today in 2023 under such pressure is best applied.
Thank you. I think that is a really interesting point. I know that's something we here at Social England talk about a lot, is about how we can, sort of direct some of our regulatory action, I suppose, towards that point about learning. What can we learn from what we know? What can we learn from what others know? And how can we focus that back into either education and training for people who are training to be, to join the register, but also how do we focus that into people appropriately throughout their careers, so that we can, show people where things may not have gone as well as any of us would have liked, and how can we focus that back into making sure that the same mistakes aren't made again, or people can learn from that directly, I think. But I take we take the point certainly about doing that under pressure, is, how we make that as valuable as possible to people without increasing or making it feel like an increase in pressure, I suppose, in people already very, very pressured environments.
I mean, I'll just come in briefly again, just on that point, is, so I think the regulator has a very clear and important role in making sure that social workers are taught what they need to know at the initial qualification stage. There's obviously then on the adult side already is the need for in terms of best interests and mental health interventions, that you've got appropriately trained and accredited people, and it's sort of no secret that I would like to see that on the side of children and families, and that we are looking at an early career framework which takes practitioners way beyond the initial qualification point. And then I think, the other obvious thing is that I think it's 1,700 social workers were subject to fitness to practice in the last year. There must be a wealth of information about the context in which they were working, regardless of whether or not that's upheld. It's kind of irrelevant. You must be gaining a huge amount of contextual information about the pressures that practitioners are facing, and how that's drawn together and then pulled through into government departments, I think would be hugely helpful.
Thank you. Yeah, I think certainly that's certainly the case for us, that where we think, the more contextual information we gather, how we can use that appropriately, both internally and, externally. Brilliant. Thank you. We've got 3 minutes left. There is just, I suppose, another question that was sent to us in advance, I suppose. I think touches, Isabelle, on the point you made earlier in your presentation about, how is this conversation regarding serious case reviews different to the conversations we had 20 years ago? And how will it differ to the conversations that we'll have in the future? And I think some of it is about, I think we just touched on there, about how we continue to extract as much learning as possible and show that learning back out into the profession really, and others, so we can, sort of change approaches where necessary, I suppose, really, to make sure that people are getting the maximum understanding of the things that are coming out from these reviews, such that we can change practice and education where necessary. I don't think anything else anyone would like to say about the continuing conversation, I suppose.
I think I would just say, from a domestic homicide perspective, 20 years ago, we wouldn't have had a domestic homicide review. So I think in some respects, we're kind of, that learning is being captured in a way that it wasn't before, in a victim focused way, and kind of drawing out some learning that we just wouldn't have had, particularly within that sector specifically. And I think, just kind of going back to the previous question, I think in terms of that coordinated community response and joining up kind of multi-agency partnerships and multi-agency learning, and drawing together some of those reviews and the learning from safeguarding reviews, but also from the domestic homicide reviews. We know that they're introducing offensive weapon homicide reviews, and we've got a number of ways in which we drawing out a lot of learning, but how are we bringing that together to kind of do that in a collaborative way, in a way that kind of does mirror that coordinated community response. But I would say that's not to say that the lessons coming out of domestic homicide reviews don't reflect the recurring themes that we've been seeing for a long time. I absolutely recognise that, but I do think in terms of that significant step forward around specific issues that we are seeing that shift, and now have an opportunity to kind of oversee that in a different way.
Thank you. Well, I've just noticed that we are now at our time, so I'm afraid we didn't get a chance to get to any questions from the audience today, but I would just like to say, you know, a big thank you to all of our speakers today for their contributions, and because it is now 2 o'clock, wish you all well for the rest of the day and the rest of the session for Social Work Week. So thank you.
Bye.